Hey everyone, my name is Derek, and in this video, I'm going to tell you how you can convert more prospects into patients during the consultation with these key strategies. So the sales process has led you to the consultation, and now it is time for you to close the deal. And nailing the consultation is how you're going to get the prospect converted to a patient that is ready to move forward with the treatment. So my name is Derek Chung. If you're not familiar with me, I run a dental marketing agency called Umbra Media. I've also built the TAP system, which is a reliable and scalable patient acquisition system that is designed to help dentists solve the patient acquisition problem, which is getting more new appointments and patients on their calendars. So anyways, on to the video. So when it comes to the consultation and how you're going to convert more prospects into patients, you want to build trust and rapport with them. So you want to emphasize active listening and empathy for a strong patient connection. So when they come in and they bring their concerns to you, you really want to listen to them. Your goal really isn't to try and close the deal. Really, you just want to provide them as much value as possible. You want to listen to them. You want to understand their problem. You want to see if that you can even really help them in the first place. And that's going to come off as more genuine. You're going to show that you're going to have more empathy. And the prospective patient is going to feel that. They're going to feel that you're actually listening to them and that you really care about them as a person and that you don't just see them as production, essentially. And by doing that, you're going to build that trust, you're going to build that rapport, and they're going to feel more comfortable moving forward with you and your services. Another thing is that you need to understand patient needs. So you've got to use open-ended questions to uncover their dental concerns and expectations. A lot of prospective patients that come in for certain treatments, they may not even know what they need. They've probably never been explained exactly what it is that they're going to be doing at this consultation, what this treatment entails. They've got a lot of anxiety at this point. So you want to ask a lot of open-ended questions, understand their motivation, understand where they're currently at, where they'd like to be, and how you essentially are the solution from getting where they are to where they want to be, and answer any of those questions that they have to really resolve those anxieties, get them comfortable with moving forward. And this is part of handling any objections that you're going to get at the beginning, because you're answering their questions and clarifying any of the things that they need to be clarified. The next thing you're going to want to do is you want to educate them effectively. So this means simplify any complex information, any medical jargon, get rid of all of that. These prospects did not go to dental school, they didn't go to med school, they didn't go to do pre-med in college. Some of them may not have ever even went to college. So using really complex terms and medical jargon is just going to turn them off. They're going to feel that they have no idea what's going on. They're going to put their walls up, they're going to put their barriers up because they feel that their ego is being attacked. So we know that you know a lot about dentistry, you know exactly what you're doing. You can explain it, to the most minute detail, but try to think of it as you're explaining these concepts to a fifth grader, because it makes it really simple for someone to understand. If you are explaining it at like a dental school level, they're not going to know what you're talking about. They're not going to move forward with the treatment. And also, instead of just explaining it, use visuals. If you have any diagrams, if you have any charts handy, it would be really good to include those so you can walk them through on the diagram or the visual exactly what's going to happen during the treatment, so that they know exactly what to expect. And this also helps them address any of their concerns or expectations around that. So obviously they're going to have a lot of concerns that are going to be brought up during this consultation. So you want to have some strategies to overcome these objections and build their confidence in moving forward with the treatment. For new dental practice owners, if you've been an associate, you might have seen the head dentist do a lot of this, who has been in the field for a long time, who has done a lot of consultations. They've got a really good essentially sales playbook. But if you're a little bit newer, you want to start building that up. You want to start role playing some scenarios and how you handle those concerns, how you handle those objections. And even for seasoned dental practice owners or dentists, you want to keep practicing that thing. You want to see, can I increase my conversion rate? How do I address more concerns? How do I handle more objections in a better way? Because this is ultimately going to lead to more prospects who come in for consultations, and they're going to end up as new patients if you're able to handle their objections correctly. Essentially, this consultation is a platform for you to handle any objections they have and lead them closer and closer and closer to the sale. So when it comes time to finally present your treatment options, you want to be clear, you want to be comprehensive, and you want to present them to them that targets their individual patient needs. You don't want to speak broadly. You want to really customize your treatment, your service, whatever treatment options that you have prepared for them exactly to them and their case. Obviously, this is just, this seems like a no-brainer, but you don't want to be broad. They want to know that they're being taken care of, that you're not just having some general solution to their issue. Talk about their case, talk about their condition, use all the information that they just gave you during the entire consultation and leverage that, when you're closing them and presenting the treatment options. And this is obviously for cases that have some sort of urgency. You don't want to create a false sense of urgency if you don't need to, but creating urgency actually helps the prospect make a decision faster. So communicate the benefits of having a timely treatment and any consequences of delays. So for example, if it's for something like cavities, you want to express how this is obviously something that is urgent. You want to get this taken care of sooner than later because you don't want to end up having those cavities get worse, you end up having a root canal or anything like that. You want to express that to the patient because in their mind, they might think, oh, it's just a couple cavities. It's no big deal. I'll come back in a couple months. But in a couple months, they might have already lost that tooth. So you want to express the urgency related to any of those treatments that you're offering if it makes sense. I don't think that you should offer any urgency if it doesn't make sense, like if it's for Invisalign. That's more of a cosmetic procedure. You're not going to obviously tell them, oh, this is something really urgent, you need to fix this or whatnot, unless it obviously makes sense. But creating false urgency, patients will catch on to that sort of thing and they're not going to like it. They're going to think that you're just trying to sell them, that you're in it for the production, and you're in it for the money. So use urgency as a tool when it makes sense. And finally is closing the deal. So provide practical tips for a confident and transparent close. Be very upfront with them. Be upfront with the price, everything that they're expecting. You don't want to hide anything from them. As much as you are trying to essentially be a salesperson here, you want to be honest. You're really trying to help them. You're trying to improve their dental and oral health. So when it comes to closing the deal, just be clear, concise, and effective in your communication of treatment options and pricing. So that's that for the video. If you're struggling to get new patients and are wondering how you can get more high-quality appointments on your calendar and you want to learn how to do that, you can click the first link in the description. There's no case study or anything like that. Just a video of me telling you a little bit about the system I've built to help dentists solve the patient acquisition problem. If it's something that you're interested in learning more about, you can click the link. You can book a strategy call with me and my team. It's totally free, very low pressure. You don't have to click it or anything like that, but it's there if you're struggling in your practice to get new patients and appointments and you want to learn how to solve that. Also, if you're looking to join a community of dentists and dental office managers that are really passionate about dentistry, dental marketing, and growing their practice, check out the link below that in the description where you can join my free Facebook group. I'll be posting more information in there, resources, free trainings, Facebook group exclusive goodies, so make sure you're in there. Anyways, that's all for this video. If you liked it, make sure you like the video. You can comment any video suggestions that you have. I'll be sure to make some more videos about that. I just want to make content that makes sense for you and that you find valuable. And if you want to see more content like this, make sure that you subscribe for more. Hope you have an amazing day. Thank you so much for watching until the end. Keep crushing it in your practice, and I hope to see you in the next video.